Welcome to Discover Health, a White Mountain perspective. I'm your host, Dr. Tom Barella. And on this program, we usually discuss things that are really important to our community, and today is no exception. Today we're going to talk a little bit about the drug education and prevention that our community does. And I know we've had Vicki Solomon, the executive director of the Nexus Coalition, on our program before. She's discussed some of the symptoms and actually a lot of the statistics that we have that indicates that even though we're in a rural community, kind of separated from the big city, that we still have to deal with these types of issues in our community. And in order to approach this topic today, we have two wonderful guests, both educators from the Nexus Drug Coalition, that actually go out to our school systems and teach drug prevention. Now, this is important for all of us as parents to know, because these are the people that in many cases are making the first effort to give our youth correct information rather than the information they may be getting on the streets. And to do this, we're going to welcome Brenda Willis and Sylvia Turley
yes,
to our show. I should know their last names, and I do, but I wanted to make sure we did it correct. And we're going to ask you, we're going to say thank you for coming on the show this morning.
Thanks.
And I want to start out by saying you guys are the front of drug and prevention education in our community. So why don't you talk a little bit, Brenda, about what the Nexus Coalition is? We've heard a little bit from Vicki in the past, but tell us from your perspective as the front face of the organization.
Okay, so Nexus Coalition, two of our main goals is to collaborate with other organizations in the community. And so what that means is we team up with them. Like if we team up with Timber Fire Mesa, they go and do Safety Village, we'll go in and educate with them, and whoever we can educate with, whoever we can collaborate with. And then we also, we connect people with each other, resources. And then the second one is to reduce substance abuse in the community.
So, but you didn't mention education.
So by education.
By education, okay. So that's an important part. I mean, you the coalition collaborates with many of the organizations. It's not a one organization thing, because it really is a community problem.
Absolutely.
And it's your job to coordinate the drug prevention with numerous organizations, not only fire department, but the police department?
Yes, the police department, the Navajo County Health. Yeah, just whoever, the schools.
And we're going to talk a little bit about one of your more important things is the justice system in the county also. So it all starts with youth. I mean,
Absolutely.
The Drug Prevention Coalition focuses on the approach to youth.
Yes.
And Sylvia, I know that that's a big part of what you do.
Yes.
I know you haven't been a part of the coalition very long, but it's been the success and expansion of the coalition that led you to becoming a board. And,
right.
And I would welcome you to this role in our community.
We're happy to have her too.
Thank you.
Disclaimer, I sit on the board of the Nexus Coalition, so I do know these two ladies quite well. So you teach programs, okay?
I do.
And so why don't you tell us a little bit about the approach of the coalition to the school system?
Sure. So as far as the schools, some of the programs I've been teaching regarding drug prevention, probably the first one I taught, we'll go with that, is OTC, over-the-counter medicine. And so what we did there is we went to the high school. I worked with student council students. We taught them all about over-the-counter medicine, how to distinguish the differences between that and prescriptions, how to safely dispose of old medicine that we may have. And then in turn, this was a peer-to-peer program, so the high school students went into the 5th grade classes and taught the 5th graders everything that they learned about over-the-counter medicine. I think that, well, to start with, I'll just say that the high school students were exceptional. They were very good. They loved it. They learned a lot themselves. And so then when they went in and spoke to the fifth graders really enjoyed it too. It's their peers telling them or explaining and teaching them. And like I said, we taught them a lot of different things about that, but the most important thing I believe that they learned was the poison control number. The 1-800-222-1222. They loved repeating it, and we'd go over it over and over again. So as you know, as well as 911, of course, but now they know poison control number for any emergency or questions they have.
Yeah, we may talk a little bit about that in the future. So essentially, you start at the high school level and teach a program to the student council?
Yes.
And then it is those student council members that you take down to fifth grade?
Right.
I mean, most people think of drug-related problems as high school problems. But you're talking about fifth graders. How old are they?
We are. Fifth graders are about 10 years old. And the reason we get into the fifth graders, kind of start there, is that I believe the average initiation age for drugs and alcohol is about 12. And so once they are about 12 years old and on into high school, you know, a little bit older, they're already experimenting, or they've already been told things by their friends and, you know, other kids at school. So we want to get in there right before that and try to reach them before they get to that age and teach them about drugs and the dangers and, you know, the things that are in there that really they don't know about yet. And hopefully that'll help at least get them thinking.
Well, we want them to start learning it from the right sources, and the fact that it's so well taken up by the high school student council, and then
it's a great program.
And then taken down. So, if you were going to give advice to the to our audience, what might be a takeaway about over-the-counter drugs that you know is salient for these young people?
Right. Well, over-the-counter drugs can be just as dangerous as prescription drugs, you know, at different levels. And so we want to be able to educate our children, our community, about using them safely. We taught them about how to read the drug facts label on the back of each bottle, the importance of that. And so mainly just knowing that just because it's not prescription or it's not something you get on the streets, it still could be a dangerous thing
we
for
talked
you.
about glue sniffing and stuff like that years and years ago, and there was recently a documentary I know about the fact that 50 years ago we didn't have safety caps on our drugs and stuff like that, because it apparently was a different type of issue years ago. But I'm impressed. I mean, I know the data in Europe suggests that starting at fifth grade, 10 years old, 11 years old is the right age to start educating people. And many communities may worry about the young age, but of course we're in the internet age now, and sources of information are freely available. Well, you're talking about OTC drugs, and that means, of course, over-the-counter type of drugs, but there's a lot of problems that people get into. And does Poison Control have any statistics on over-the-counter versus prescription drug overdoses?
They do. I have not looked into the newest statistics, so I won't get into that, but they do. And if you get onto their website, you'll be able to find all that.
And actually, it's quite significant.
Yes.
The over-the-counter drugs are probably maybe an even greater problem, especially for young children, than for other things. And so that's an impressive approach. And you teach other programs, I'm sure.
So one program that I started teaching at the junior high level is called Avoid, and it's, I'll read it because I always forget, it's Anti-Vaping Online Information Dissemination. And that's mainly a vaping, that's mainly a vaping program. And so, like I said, that's junior high level, 7th and 8th graders. And what I'm doing there is what we're doing is teaching them about vaping, the different chemicals that are in the vapes that we're not even aware about, the metals, the things that get mixed in with them. And
there was a big issue recently with all the lung-related deaths.
Right. So it's not just the nicotine that's highly addictive, it's also the other chemicals that gets added to them. And so we're explaining all those things to them. We're teaching them refusal strategies.
Peer pressure,
all that good stuff. So
Is vaping a significant problem in our community?
it is. I think it's a problem in every community. We definitely have it here as well. And even like I said, at the 7th, 8th grade level, the students took a survey that asked them questions such as, do you know about them? Do you vape? And there's a significant number of students that are vaping.
And actually, when Vicki was here, she indicated to us that 29% of the kids up here are exposed to vaping, and that was the highest statistic in the state of Arizona. So
yes.
This program is very important to get the kids with some real knowledge
right.
of the potential side effects of vaping and the potential yucky part of it. Do the kids seem interested?
They do. I think they enjoy the class. A lot of things the kids say they already know. I'm repeating things that they've heard over and over again, and so, but they are learning new things. And so I just tell them to keep an open mind. You're going to hear something a million times, and that's a good thing. They will hear something different every single time. They'll get something out of it every single time, and so it's good to just hear us out. We have information, we have stats. But
do they ever try to argue with you?
No, I did have one. Although I did have one that said, well, if we get rid of vaping, we're just going to make something else, and that whole argument. And I said, yes, that's true. So, but otherwise, they're really receptive to it.
Okay, but with correct knowledge, you can't do anything other than give him the knowledge,
right.
and let him make up.
Right.
So we approach over-the-counter drugs, we approach vaping, a significant issue, and we have other programs. But don't you teach one more program?
So I am teaching
Empowered?
No, actually that's Brenda that's teaching that one. And I have taught that class, but Brenda is the superstar in that program. So
all right.
I'll get that to Brenda.
So we'll go to let's go to the superstar now,
yes.
Because I know she's involved with a couple of really significant programs. Can we start with Empowered?
Sure.
Brenda?
Yeah. I'm actually teaching Empowered right now in the Blue Ridge Junior High. And it's a great class. It's a 12-step program that the youth put together. They got tired of their friends dying, and so they put together a 12-step program. And so
the youth did this.
The youth did.
Mm-hmm.
Here?
No, it wasn't here.
So it's a national program?
Yes, and we went down to the valley and got certified to teach it.
Okay.
And so they facilitate it. And so I'll start it out in the beginning of the year. I'll start it out, and then I turn it over to them, and then they facilitate the meeting, and they like that a lot. So it's a leadership meeting. Also.
And this is just in a regular classroom?
I have about right now I have 7 students. We'd like to have about 12 at least in each classroom, but I have about 7, and so in a classroom, and we do it once a week.
For how many weeks?
So the whole school year.
So you go into the school year in junior high once a week through the whole school year.
The whole school year.
This must be an incredible program. So what does it teach?
So it teaches, some of the lessons are, we talk about addictive behavior, letting go of resentment. We talk about our higher power, whatever that higher power is. It's different for everybody. Making amends, serving others, leadership, if you're offended, how to, some of those resiliency skills. We talk about bullying, anything that we can teach them that goes back to these building resilience. So accepting that change is part of a living, taking decisive actions. We did a class last week on self-love because a lot of students have a problem with that, and so that was our class last week. Keeping things in perspective and to maintain a hopeful outlook. So those are the things that we implement into it. And we also implement, of course, we do the drug education too. We'll talk about throw the marijuana and stuff and talk about that too.
Wow, what an
So-
impressive program. The school system really is committed to this, to give you, what, half an hour every week?
An hour.
An hour every week.
Yes, an hour.
In the education. And really, this program seems, from your description, to extend far beyond the issues of drug prevention.
Yes, it does. And the kids love it. For one, they can come in. What they really love about it, it's a safe place. So it's very confidential. It's a safe place. They can be who they are, and they don't have to worry about if they're, like some kids have ADD or whatever, and they have a hard time sitting, they have to worry about getting in trouble for it or whatever. They can kind of be who they are. They can express themselves without being made fun of, because that's part of the Empowered is supporting each other. Like, that's a huge thing. We say a pledge every week, and that's part of it is giving support to each other. And so just that support group, and they gain those relationships, and they love it. They love the program. And when I've gone to the high school to teach, I have my students that have, a freshman. They say, how come we don't have this program in the high school? And so they would like to continue it from the junior high to the high school.
It seems like an incredibly important step for the transition between childhood, teen, and adult.
To me, is what's so important about this program. And so we have a To Be Empowered too, which talks about balance in life, letting go, loving yourself, prejudice, what you can control, what you can't control. And so for me, we have kids that are coming to our schools, and we don't know what has gone on in their lives, right? And so, for example, if I can, I'll just share a little bit of my story.
That's what makes it good.
So growing up, my parents divorced when I was in fourth grade. They divorced, and I was born and raised here in Shoalo. And when I was in fifth grade, we moved from Shoalo to the Valley, and so I left all my friends that I grew up with, moved to the Valley, and my mom remarried a man, and so we moved to the Valley. And then she was only with him for maybe about a year, but by the time I was in sixth grade, she divorced him, and so we moved back up here. And then she met somebody else, and so we moved to Holbrook my seventh year, and then she was with him for a little while, and then we moved back. And then my eighth grade year, same, she met another man.
So lots of changes.
And so I went to two different schools, and from fifth grade to my junior year or my freshman year, I went to two different schools. And so then I would go to a school, and the teachers don't know what's going on with me, right?
Right.
And so in eighth grade, I started with drugs and smoking and stuff, because I was just trying to survive in life. And so and so the teachers don't know what's going on. They come in and they see these kids, they smoke or whatever, and they have that stigma. They're a bad kid, and they're not bad kids. And so we need to find out, ask the question, why are they doing this? Not like they're bad or this and why. But these programs give these kids a place to come to where they can maybe express some of that, or be able to feel a part of something, feel accepted, feel loved with no judgment. And so I think that's why they're super
No wonder
important.
you're so good at it. No wonder you're a superstar.
She's the superstar.
It's always, my first comment is that these are incredible skills that all people need to develop.
Yes.
It's been my contention as a pediatrician that the difference between childhood and adulthood is that adults learn from someone else's mistakes. Children feel like they got to meet their own mistakes.
Right.
So whenever they are able to make that transition to learning from being empowered and stuff like that,
yes.
is helping make that transition from childhood to making good decisions as adult. This sounds like an incredible program that the kids involved with. Is Blue Ridge the only school district doing it up here?
So right now, Blue Ridge we would like to get in all of the schools.
All
yes,
schools
we would like
in the
to be in
area.
all the schools. Yes, absolutely.
And because it sounds like an incredibly important program for the kids, and I'll bet you have lots of stories that you can't tell tell our audience, and that's part of the importance of being able to give these kids the ability to say things under those circumstances. What a great program, and a compliment to the school system for instituting this. But as another aspect of what you do is when kids run afoul of the law, and I know that another program that you're involved with that's been incredibly successful has been the Teen Court program. So I'm sure that our audience knows nothing about Teen Court. So why don't you describe it a little bit?
So Teen Court is actually through Sholo High School. Krista Rask is the counselor over that, and so it meets about every other week, at least twice a month, and it's a regular court. It's run, but it's all teen. The only adult is the judge. So the jury's teens, the attorneys are teens, the bailiff is teen. It's all run by teens. And so when kids get caught vaping or marijuana or alcohol, whatever, or speeding, whatever it is, they have the option to go through Teen Court. And so
if the legal system gets them, one of the options offered to them is to go through their peers in Teen Court rather than an adult court. Okay.
Correct.
So so they go through Teen Court, and then so they listen to what they did or whatever, and then the attorneys will ask them questions, and then the youth will go deliberate and come back, and then they'll give them what their consequence is. And so that's where we come into play. We offer diversion classes, so for alcohol, vaping, marijuana, whatever drugs.
So what's a diversion class?
So diversion classes, so they'll meet with us. Like I said, the jury decides if it's alcohol or marijuana. They decide how many classes that they think that the youth needs, and so they'll set up like 3-4 classes. We had one kid who had 16 classes. He was underage drinking, and so he had 16 classes. So he came to us, and we did 16 alcohol diversion classes with this youth. And so.
And these are classes that you teach?
Yes, yeah.
And the curriculum for those classes comes from?
So that's what's fun about it is we don't have a set curriculum.
Okay.
We have things in place that we teach them. We don't even if they get caught for marijuana, we're not just going to talk about marijuana because it usually doesn't stay with marijuana. It's there's cigarettes, vaping, alcohol, it goes
exposed to other things too.
So we talk about the drugs, but we also try to teach we talk about stress, the resiliency skills, pro-social activities, things like that. We talk about try to teach them to think about their future, who they are, what they want out of life, where they're going. And so it's just a whole big old package. It's not just on that alcohol or that marijuana. And then we also teach an in-depth class. Now the in-depth class is a vaping class, and that is a 4-session class. They do have to come to 4 sessions. It's set.
And is that something that you teach?
I have done that as well, and the kids, I've had it where the kids are not so excited to be there, of course, the first lesson, but then, you just teach them with love, with compassion, with understanding, and you're not there just to judge them, to belittle them at all. You're teaching them things, and you're just making them feel okay and not judged, and they'll be more receptive. But I have taught the class, and by the end, they love you. They really do.
Well, I can see why the two of you are so soft-spoken and stuff. But vaping is really a big issue.
It is.
I mean, it's like the transition. Have you guys seen any changes among the attitudes in your teaching since these kids have? These kids nationally have died. Do the local kids question that issue?
Yeah, so in the Avoid class that I taught, I did ask them, how many deaths do you think the U.S. has seen related to vaping? And the common answer was, 5, 10, 15 or whatever. I had checked the CDC that morning, and as of February 18th of this year, there had been 68 deaths related to vaping. So, and about 2,000 that are hospitalized, not necessarily deaths.
Have medical care.
Right. And so that was a big number for them. I believe they see that. Whether they register it now or later, that's okay. But at least they have that education, ahead of time, those stats, and hopefully they'll remember it.
Wow. What I'm impressed with listening to the two of you talk is how non-judgmental your approach is. To me, that seems to be the key with dealing with youth.
Yes, I think so.
Absolutely.
Do they ever comment about how comfortable they are with the teaching approach? Or, they must, if they're going to talk to you.
What I've seen is that they don't necessarily come up and say, I love that you didn't judge, I love that,
Right.
that you're so different, but they'll say hi to you later. They'll actually come up and they'll remember you, and they like you. Kids don't usually like adults as well when you're trying to tell them something that they should or shouldn't be doing. But I believe that, because of their interaction with you later, that you've made an effect on them.
Well, that must be terrible, your experience, Brenda, because Empowered, you got a lot of contact time with them throughout the year, and to me it seems like the program wouldn't be successful if you could not make an early connection.
Yeah.
You obviously are able to make connection with student council type people, but you must be able to make connections with all of those kids throughout the school year. You just grow to love the kids. You just love them. They're great kids.
They're all great kids, regardless of what situation they're in, and because, like Brenda said, we don't know what their life is like, and so the fact that some kid is acting out or needing extra attention, just keep that in our minds. And
I think parents in our audience should understand when we talk about the ACES programs, and we've had Allison Hefner on the show to talk about the ACES program, where adverse childhood events, and just how significant those underlying things are.
Right.
Yeah.
The problem is right now is that we're almost out of time. Now
That is
that
a
you
problem.
didn't expect that. And I'm going to say to our audience, I'm going to thank you two wonderful ladies for joining our show today. As you can see, that it's really important that we start education early in our youth, and it is important to have non-judgmental programs that are continuance. And I think you can see that these two ladies that have been on our program today are very good examples of how to approach our youth in education in prevention of not only drugs but other aspects of their life. And I'm going to thank you for watching today.